if you're ready, go ahead and take it away.
Great. Thank you, Kim. Well, I'm very excited today to share with you our ERP4Health offering for healthcare and senior living providers. I've been working in this space for about 30 years, and we have accumulated as an organization lots of best practices, tons of talented people, lots of great clients, and lots of software and tools to help our clients. So our goal today is really to give you an introduction to ERP4Health powered by Microsoft Dynamics. And to help with that, I would like to begin just a little bit on giving you some background on InterDyn BMI. If you've been with InterDyn BMI for a long time, there's been a lot of changes in the last few years, and I'd just like to make sure you're up to speed on those changes because our ERP4Health offering really includes the talent and the resources of our entire organization. So first, you may have seen this before. Our mission is to enhance the lives of employees and clients by working together to provide quality business solutions. That is what we've been doing for 30 plus years as an organization. And real quick, if you need to be brought up to speed, lots of changes in this area. We're at 158 team members and growing. 22 locations, over 2,800 clients, with most of those being Microsoft Dynamics ERP clients. Over 30 years, as I mentioned earlier, and our average talent base is 10 plus years on the consulting and the sales side with ERP experience. So just a little bit of a map of all of our locations. Although these are physical locations for our organization, most of the work done today for our clients is done virtually and remotely. Being with Microsoft for as many years as we have been and the success we have had, we're at the top of the food chain with Microsoft in just about every category when it comes to the Microsoft Dynamics product suite. We do have a unique branding and recognition within Microsoft in that we're a Microsoft Dynamics healthcare partner. How we have gotten to this success as an organization is really in our digital leadership that is bringing you the latest and greatest in technology, such as business intelligence or things that have to do with, in the future, like Internet of Things, connecting to devices, collecting data, big data, providing you in the future artificial intelligence, like with Cortana, which is part of the Dynamics suite today. So we're doing a lot of things that will be part of your lives in the future, and including those in our solutions starting today. As I mentioned before, our experienced people, our people have a lot of best practices in various industries, particularly the health industry, and also many, many customers. I'll show you a slide pretty soon showing you over a couple hundred health industry customers that we have today. And lifetime relationships. Most of our customers have been with us over 9 years, and that is a huge achievement in that we look at every customer as a lifetime relationship, not just an initial implementation. So something else that you may not know if you've been with our organization, it's very much part of our ERP4Health offering, is that not only do we provide implementation and training services, we also provide integration and migration services, application development, whether it be .NET or application specific for Dynamics GP or NAV or AX. We have business process consulting expertise. Obviously, we do upgrade services as you need to transition to new versions. We have a complete IT and managed services staff, whether you need help with IT services or complete outsourcing of your IT services for your on-premise servers and hardware, or if you want to go to the Microsoft Cloud at Microsoft Azure, we can help you with that as well. So getting down a little more specific into health industry for us, there's two sides on the provider side within the health industry that we focus on. One is healthcare providers, and that is hospitals, medical offices, clinics, laboratories. And then on the senior living side, everything from independent living, assisted living, skilled nursing, CCRC, home care, hospice. So when I use the word ERP, I'm using it in the traditional sense, or the same definition that Gartner would give to ERP, and that includes, basically your enterprise resource planning system, which includes CRM, includes corporate performance management, includes BI, basically includes your business applications. What our offering for healthcare and for senior living does not provide is we are not providing the EMR, or that is electronic medical records, the patient billing, or the resident billing, or the property management systems. We do not provide that piece. We provide integration into those pieces, and we provide the rest of the suite. So we'll get into that a little bit further. But just to make the point here, when we use our terminology ERP4Health, it is the entire business application stack. Now, regarding, is ERP4Health a product, or what is it exactly? ERP4Health is basically, it's our services, it's our experience, and software. So it's our practice. It is not a product. So just want to make that clear, that it's not something you buy off the shelf. It is our entire practice and the services, experience, and software we bring to bear. So we've categorized our offerings, and our offerings we've given some further definition to. So on the ERP4Health standard side of things, we offer that powered by Microsoft Dynamics GP and Dynamics 365 financials for those organizations that don't have HIPAA compliance. Let me clarify that. If you want Dynamics 365 and you don't need HIPAA compliance, then we can offer you that on Dynamics 365 as well as GP. So GP, we do have HIPAA compliance. 365 is coming in about 12 months. ERP4Health Advanced, we offer that for multi-entity or multiple legal entity type organizations on the GP and the NAV platform. And on the enterprise side, we offer Dynamics 365, what they call Operations now, or the enterprise edition of Dynamics 365. And that as well will be HIPAA compliant in 2018. Regarding CRM for Health, really a subset of our ERP4Health offering. Sometimes we will use this labeling just as a subsegment of our offering, and that's powered by the Microsoft Dynamics 365 CRM components. And then Corporate Performance Management for Health, or CPM, that's powered by BI360, which is using the Microsoft tools such as Excel and Microsoft SQL Server. And then we have Microsoft Office 365 for Health with templates and best practices around HIPAA compliance for using Office productivity tools. And also Microsoft Azure with all of the compliancy for healthcare as well. So just a little bit different picture of what we were just talking about. And at the enterprise side, I'm just going to show that slide only because it shows our complete offering. Whether you're at the advanced edition, maybe running on Dynamics GP today, or NAV, or whether you're on the standard edition, most of these components are available. But on the enterprise, we have all of these capabilities. And that would mean on the Dynamics 365 Enterprise Edition, we have financial management, so your core AP automation, your general ledger, your budgeting, your financial statements, your consolidations. We also have supply chain management, the procurement side, so dealing with healthcare materials management is also a capability we have. We have facilities management capabilities within the system, project automation, and then you see down below production. That really applies to our life sciences companies for ERP4Health, not for healthcare. so that would not apply in your case. And then our connectors. Our connectors are a real big piece in that it allows us to connect with a number of different patient resident billing systems. And also corporate performance management, as I mentioned down below there. We also work closely, because the Microsoft Dynamics family works closely with Office 365. A new addition to Office 365 is Staff Hub, the brand new tool for helping schedule staff. It's getting a lot of great reviews, and we're excited about offering that to our clients as well. And then Power BI, which is a relatively new tool, Cortana Intelligence, which is coming on strong as part of the new Microsoft Dynamics versions, and then attaching to pieces of equipment and movement of things and people for the Azure Internet of Things. So a lot of great capabilities across the board. Obviously with the Enterprise Edition we can offer more, but for the most part all editions will have a good portion of these things. So what are some of the key benefits of ERP4Health? So some of those key benefits we see is primarily HIPAA compliance, the patient billing connector I just talked about, offering HIPAA compliant cloud services on Microsoft Azure, accounts payable automation, the multi-entity management, the financial statement reporting and consolidation capabilities, the purchasing capabilities to help control costs, healthcare materials management, whether you need part level management or whether you need 2-bin Kanban, have a central store for centralized inventory and dispatch out to the facilities. We can handle that. If you're more on the nonprofit side, we do have grant management capabilities and encumbrance management. And if you're looking for a single tool to provide to your executives and managers for your dashboards, your planning, and your reporting across all your systems, we offer our corporate performance management tool that allows us to bring into a single data warehouse your data from your billing systems, your EMR systems, your payroll system, and from your dynamic system into one place for that reporting and planning. And then our CRM is really used for a number of different things by our clients: patient, facility, physician relationship management. We have a number of different use cases and how our customers are using those. On the HIPAA compliance, just getting a little bit deeper on that, really important. The penalties are stiff. We have a custom legal agreement between ourselves and Microsoft as a HIPAA business associate with them so that we can offer Microsoft Cloud services to our clients, and Microsoft provides a HIPAA BA agreement. We will provide a HIPAA BA agreement. We know how to make your data at rest and your data in motion encrypted, whether it's on your premise or whether it's in the cloud. And we have a HIPAA compliance officer that's keeping us all in line. On the cloud services side, again, very important that it's HIPAA compliant and we get all of the security and the scalability that Microsoft Azure Cloud Services provides our clients. On the connector side, it's not just billing that we connect to. We also have the capability with our connector to bring in payroll information. A number of our customers are not using the Dynamics payroll, so they're using an outside payroll service, and so, or an outside payroll system, and we can bring that data into Microsoft Dynamics financial system. And some of our larger customers may have POS systems, especially in the senior living or hospitals, where they need to bring in those transactions into the system as well. So our connector can bring that data in. It basically is a polling system. It keeps looking for that file that's being provided by those other systems. We bring that in, archive the data, we encrypt it, and then we translate the data, and then we provide that through the Dynamics business logic for review and posting. So just a real example of some of those types of transactions we can bring across. We can bring across the general journal. Apologize, it just advanced forwarded on me there. We can bring across the general ledger journal entry, the revenue, payroll, any POS transactions. Again, we'll translate it over. And then we have statistical information, so we can bring across any patient encounters, any occupancy information, information from payroll like payroll hours. We can also, apologize, looks like I have an auto timing going on with my slide there. On the banking side, we can bring in the deposit, so you can use the electronic bank reconciliation capabilities. On the accounts payable side, we can bring in patient refunds. On the payroll, bring in the payroll liabilities. And then if you are using healthcare materials management, we can sync up with any patient charges that you have on the material side. AP automation is huge with our clients because a lot of them have multiple locations and multiple companies, and people are getting invoices at those locations. And so being able to capture that image and route it for optical character recognition and have it automatically inputted into the dynamic system and routed for approval is a huge savings, both in cutting down the closing time for the finance department at the end of a month, but also to accelerate the approval process and understand cash flow status. Also, EDI is important. If you need communications like with McKesson or Cardinal, we have solutions for that. If you're looking at really controlling costs across the organization even further, want to deploy a purchase order management processing or requisition management, we can help with that as well. So in the multi-entity capabilities, that's very important with the companies we work with because most of them have multiple legal entities. So the ability to operate with many legal entities that are like kind, where they have a like chart of accounts, same vendors, have centralized AP, we can accommodate that capability as well with our ERP4Health advanced offering with GP and NAV. Materials management, as I said, if you have par level or two-bin Kanban, we can help with centralized or decentralized materials management. We have solutions for that. On the corporate performance management side, again, if you're looking for a tool that goes across your enterprise, across all your systems, you want a single reporting, planning, dashboard tool, we can bring all that data into a centralized data warehouse and provide that. This really eliminates what we see today in a lot of organizations in healthcare and senior living of spreadsheets where people are having to get information on PPD information, census information, maybe getting it from the resident billing system. Sometimes there's more than one patient system, and they have payroll systems, they have legacy systems, trying to pull all that information together, including the financial information, and creating spreadsheets for daily, weekly, monthly, quarterly reports that they're sending out to the management team. And then turning around and trying to develop a planning model around all those numbers within spreadsheets. So this really eliminates and puts into a SQL Server workflow environment, a web interface type environment for the users that really cuts down on the errors and the handling of information. Here's another graphical picture of that, and that graphical picture kind of just shows everything going into the central data warehouse from multiple systems, and then allowing the users either through a mobile device, their desktop, being able to get the information either in an Excel or PDF, via email, via web portal. You have all that capability with our CRM4Health product powered by BI360. On the CRM side for health, I really call it XRM, and that it's really anything you need. But here's some examples of what healthcare customers and senior living are using it for. It could be for resident or patient management, offering a centralized place for all your records for doing marketing, or just a kind of a master area for patient information. That's important, especially if you have multiple systems that you have patients going through. We have chronic disease management. There's physician management you can do through there, your social engagement, marketing. Some people use it for facilities management, and the field service capabilities are built into the system, and community outreach. Here's just a sampling of some of our 200 plus healthcare organizations that we work with, and some of the engagement tools that we use to help you every day is we have support. It's going on every day of the week with dedicated support team. Our team assigns an account manager, so if you're a customer of ours, you have a dedicated account manager, you have an account executive, There's our ERP4Health site that provides basically the latest and greatest what we're offering to our healthcare clients and to prospective clients. We have our LinkedIn page called Let's Talk ERP4Health, which is kind of what's hot right off the press that may not even made it to the ERP4Health site yet. We have our monthly or every 2-month newsletter that comes out. And if you're not getting that, please let us know and we'll get you on that list. We have an ERP4Health YouTube channel that provides information for our ERP for Health Standard, Advanced, Enterprise, as well as CRM4Health and CPM4Health Solutions. And we go to a majority of the major conferences. We're going to be at HIMSS coming up here in a couple of weeks. We were just at MGMA in the fall, and we're going to be at HFMA in June. And I'm probably missing 1 or 2 others, but we're very highly engaged in the industry conferences. Alpha was another one that we've been to on the senior living side. So I'm going to stop right there, and we have about 5 minutes left. We'll open it up for any questions that you might have that I can answer.
All right, everybody, on the right-hand side, you'll see the questions area. Simply type in questions that you'd like to ask Tad. I don't have any questions in the queue, so let's let folks type those in. I'm assuming that some of the folks that are on the line here are already involved with us in the healthcare industry, but it might be new to them now that they're understanding that there's a solution. There's different products that we bring to the table and all. What is the best way to get engaged with us, Tad, so if they want to learn more about some of these components or these areas, what would they do?
Well, I would think, number one, if you want to just get at a high level, get the information I provided in this webinar, go to ERP4Health.com, and you can either click on the info button there to request more information or contact myself. There are links on that page. Or you can just send an email to ERP4Health@InterDyn BMI.com. Or if you want to just contact me directly, you can contact me at tad.remington@InterDynBMI.com.
Excellent. And I think one thing, too, in working with account managers, I know that we've got some that specialize in the healthcare industry. One thing is to set up an eval with your account manager where you can go through and understand, well, what do I have licenses for today? And what are you, so to speak, kind of missing as part of this packaged opportunity, because it might be helping you in better reporting or dashboards, things like that that people are asking you about today. So that is one recommendation. I would also reach out to Genevieve or whomever your account manager is. And if you don't know who that is, you can get in touch with User Experiences at InterDynBMI.com, and I'll make sure I get you in touch with the appropriate people. I think it's good to do a checkup, I guess you could call is what an eval is. What do I have? When are my licenses need to be renewed? What should I be looking at for some of these best practices? And that's really what we can bring together with our total ERP4Health solution. Anything else, Tad, that you can think of?
No, just thank everyone for their time and looking forward to hearing from you.
Excellent. Well, thank you, everybody. Again, we gave you a number of email addresses to get a hold of if you've got follow-up questions, which we hope you do. But also, we will be putting a copy of this recording out on our YouTube channel here within 48 hours, and you will get a follow-up email pointing you to that, so you can go back, re-listen, and share that with other people in your organization. So, everybody,